everyone, and welcome to another edition of the Scenic View podcast. I'm your host, Jonathan Owens, with Artis Watkins and Suzanne Beasley. And there's another podcast that I like that always has a segment at the very beginning called What a Week. And I think that's appropriate for us this week. We had a huge week, lots of things to talk about. It's May 8th. We're recording on a Friday for once, which is allowing us to get all kinds of topics in. So let's just dive right into it. Our week started a little earlier than maybe we expected. Last Friday, Atrium announced that it was guess we'd call it a merger. I don't know if it's really a merger with WakeMed, huge hospital in the Triangle area. Atrium is the largest hospital conglomerate in the state, and they're from the Charlotte area. Uh, that set off huge uproar from all over. State Treasurer Brad Briner released a statement early on, questioning whether this is a great idea for the state health plan because so many of the state health plan members are in the Triangle area, and when hospitals merge like this, it always leads to higher prices. And then we also released a letter to the Lake County Board of Commissioners, who has to approve parts of this merger, like not really the nuts and bolts of it, but artists can tell us a little bit more about exactly what they have to do. But it became a huge issue because the Wake County Board of Commissioners were meeting on Monday night and they were going to vote on it. So basically, we had maybe 2 days over a weekend of heads up over this. And state auditor Dave Bullock also released a letter coming out against this merger. So it was a huge deal on Monday. Tell us about it, artists.
Well, I mean, first of all, to get into the intricacies of how it works for the Wake County Board of Commissioners and whether or not what they have to do to approve it and whether they really play a role, the bottom line is this. The Wake County Board of Commissioners chair, Don Mile, made public statements about, it's not even our decision to make. Well, yeah, it is. That's 100% not true. Wake County commissioners can make or break this deal. And so what the public is pretty clearly asking them is put the brakes on this and at least hear from us, because I don't think the county commissioners, from the limited stuff they're saying out loud, I don't think they fully understand what this is going to mean, not just for the people of Wake County, but usually public officials care not just about their county, but about, everybody in the state. For Wake County, it's a terrible deal. It's a terrible deal. You would have more monopolization of the healthcare in Wake County, which is already one of the most expensive places for healthcare in the most expensive state for healthcare in the nation. So Treasurer Briner, obviously, as the person who has the state health plan in his agency, properly said, look, this is going to be a huge issue for the health plan, a huge cost driver. And remember, if something impacts the state health plan, it impacts everyone, because the state health plan is about 1/10 of the commercially insured population in the state. So he spoke out, and Auditor Bullock spoke out and said, I have problems with this. There's no transparency around this. And then Mayor Janet Cowell of Raleigh, who used to be treasurer a couple of treasurers ago, it is the first one that had the health plan under the Office of State Treasurer, spoke out and said, this is not good. I want you to take time as well. It was weird, though. So Monday night, they postponed the vote for 90 days. Tuesday, WakeMed and Atrium, who they're wanting to merge with or let by them or be taken over by, they had a press conference together and said, look, we've been working on this for 2 years. Well, that just made it worse. Like, why do you give 2 days notice, a weekend, 2 days notice of a meeting where you're going to make a seismic change in healthcare in this state that you've been working on for 2 years, and you think the public should just swallow that real quick? And I gotta tell you, here's something that is the biggest deal about this. In the year 2000, so 25 years ago, North Carolina had 53 independently owned hospitals. We now have 20. That's according I got that figure from an article, a very well done article about this whole situation in the Assembly.
Yeah, I was just reading through that. Less than 10% in North Carolina are independent now.
And so if you wanna connect the dots, why are we number 1 most expensive, you
Yeah.
know?
So going back to the commissioners for a second, I
Mhm.
thought it was even more shocking that it was just on the consent agenda. Like it wasn't even on the real agenda. They could have just up or down voted it with a lot
Correct.
of other issues. Do you think the commission had a heads up on it, or were they blindsided by this too.
I think they had a heads up, let's just say that, okay?
Yeah.
I'll
I
leave
mean,
it
they had
there.
to, right? So,
But in our experience with the boards that we have to deal with for state employee issues, very seldom do folks not have an idea
Yeah.
that things are coming.
Sometimes folks don't feel free to talk about it.
That's yeah.
yeah.
There's a lot of things at play here.
There
Shout out to Dale Falwell, who, was treasurer for 8 years and trying to take on exactly this kinda thing that the hospitals were doing, the consolidation and so forth.
And he screamed about this with us beside him, and no one cared, and no
Right,
one
so this
listened.
happened previously in New Hanover. They had if it wasn't the number 1 rated community-owned hospital in the nation, it was pretty close down in Wilmington, and they had a takeover there. Their county commissioners voted that Novant Health could come in and run the system, and almost immediately, they had public outcry over prices, over and they're
yeah.
continuing to have public outcry. There's lawsuits that have been filed over all kinds of things with regard to the hospital being insufficient down there. There's a lot of the bottom line is there's just a lot of public real discontent with the hospital, and in Asheville, you had a similar scenario where Mission Hospital was taken over by HCA, one of the biggest conglomerates in the country. That has been one thing after another, including the nurses wanting to unionize because of how they felt they were treated by the company. There's been a lot of public complaint up there. I don't know of a situation off the top of my head where this kind of thing has happened to a community hospital where it ended with everybody happy.
Yeah, and Briner, he's just been throwing facts out from what I've noticed of all of his
Yeah.
correspondence. I see one here in this assembly story, and it is really good story. He said WakeMed runs at a 4% profit margin. Atrium is at 11%, and Mission Hospital is at 10%. And that makes the case right there, right? I mean,
Well, what okay, so what he was trying to address, Wake Med said, "Look, we have to do this. We have to merge. We have no choice because we are broke, and
yeah.
we have to replace our aging facility there in Southeast Raleigh. We don't have the money to do that unless we have a big partner who's got deep pockets." And Treasurer Briner runs the local government commission. He knows exactly what they have, and he came out and he said, "What? That's not factual."
Yeah.
So, he pointed out, you could do that just fine by yourselves, and he was a little confused as to why they're claiming poverty.
And, overall, they're supposed to be nonprofit hospitals to begin with, right?
Yeah, for what that
Yeah.
means in this state. I mean, Atrium is a nonprofit hospital.
And when this
So,
first came out, Friday, I think your first statement was their CEO makes $25 million a year,
yeah.
and that's
Well, it was a 49% increase, I think, to in his salary and into the C-suite, the entire C-suite of Atrium. So, one of the strange things about all of the really, really strange things was WakeMed, which has a long history of representing an underserved community, saying, "Look, Atrium aligns with our values and in treating and serving underserved communities." When everyone was scratching their heads saying, "Okay, these are the guys that just gave themselves massive raises," and, make the CEO makes a salary second only to Bank of America CEO in Charlotte. All those companies in Charlotte, but, the hospital serving the underserved population has the guy making the number 2 biggest CEO salary in Charlotte. So people were scratching their heads over that, but there's also been considerable consternation over Atrium's billing practices. So that's another thing because who's gonna be hit hardest by billing practices that are, at this point, questioned? It would definitely be underserved populations. So people are really just scratching their head over, "What are you talking about? And you say you're broke. You say you need a partner that's just as committed to the underserved populations as you, and then none of it makes sense? So take that for what you will, but know that if you live in Ashe County, if you live in Elizabeth City, you may think this does not matter. It's not gonna affect my life. It would. As
yeah,
healthcare, these monopolies chomp everything up, then you're looking at a situation where healthcare goes up across the state. That's why Treasurer Bronner has, in fact, John, like you said, been very in his very factual way. He's not an aggressive person. It's not his style, but he is. I think the assembly even said he's being a bit Falwellian on all this stuff, but with a completely different style. He's
yeah.
incredibly factual and, well, Treasurer Falwell, in fairness, used facts too, but Treasurer Falwell had a very aggressive style. Treasurer Briner is using his style just to say, "I'm not just gonna sit here and watch while this gets done. I'm hoping what it leads to, though, is transparency of the prices, because that makes me wanna know, what is the state health plan paying Atrium compared to what the state health plan is paying any other hospital?
Right.
Yeah. Now, from here, I guess the commissioners voted to, put I guess, the table the, issue for 90 days while they can seek public input, right?
Yeah,
So
but what's strange is they did that, and then, like I said, the chair of the board of commissioners said, "Look, we don't really have the decision-making authority." What he said out loud during that meeting was, "Yeah, we'll table it for 90 days while, or pause it," they said, "for 90 days while the public can make their case to Atrium and to WakeMed." We responded, we don't care what Atrium or WakeMed thinks about the public's thoughts at all. Like, less than 0 is how much I care about what Atrium and WakeMed think about what we think. The board of commissioners in Wake County needs to listen to its people, and that's who needs to care, because they do have the final decision-making authority.
Yes,
John, let's let them know, people know how they can reach out to the Wake County Board of Commissioners, because they need to.
'cause that's important. I know I'm from Wake County. I live in Johnston County now, so they are not my commissioners, but I have a lot of friends who are not state employees. And, I shared this stuff on social media. So, everybody needs to do that too, because if you live in Wake County, now's the time. And there were people who were alarmed, who had no idea, didn't realize how big a driver the state health plan is for costs, but, didn't know that this was even happening in their county. So, encourage anyone to, be heard, speak your
yeah.
piece.
We'll set up on our website a page with all the contact information for the commissioners. They actually have a tool on their site. It's kinda hard to find. I actually had a lot of problems finding it myself, so we'll make it easier.
It is tricky, John, you're right.
Yeah.
So, yeah, you had to go to a page and then to a link, and it was really complicated. I even had to ask you how to do it. We'll make it easier on our website, so you can just go to scenic.org and you'll find it there. I think that everyone in the state, not just in the Raleigh area, should care about it, because it's gonna make if you're on the state health plan, it's inevitably gonna make some impact in your wallet if prices go up at WakeMed.
According to the treasurer, a big one.
Yeah,
And
because
listen, that also means contact your legislator no matter where you live
Mhm.
and tell
Mhm.
them, "This thing's happening between WakeMed and some other hospital,
Yeah,
and it's gonna make my costs go up. Healthcare's already out of control. What are y'all gonna do about it?"
Yeah.
yeah.
And I don't there's debate now over whether the legislature might try to do something, and over what they could do if they wanted to. Trust and believe the legislature has found a way to get involved in pretty much anything they want to get involved in, so you gotta put this on their radar.
Speaking of former treasurer Dale Folwell, he, was quoted in an opinion piece by Andrew Dunn in the Charlotte Observer today about the whole issue. He said all of these executives would in this proposed transaction would laugh all the way to the bank. This could all be corrected in one afternoon with the courage of the elected officials. He hasn't lost his fight, right?
Well, I mean, he's not incorrect.
Yeah.
It's not like the General Assembly back in the day was helpless when he was trying to put some limits on the unchecked power of hospitals to just charge prices they don't have to be public about to the state health plan using public money. He's not incorrect.
So this same article mentions draft legislation that came up in March about cutting a property tax exemption for nonprofit hospitals from 100% to 50% of appraised value.
Yeah. Now remember, nonprofit hospital sounds like you'd be picking on somebody if you didn't give the full exemption to a nonprofit hospital, but those nonprofits are, they're making money. And Atrium, like we just said, is a nonprofit paying its CEO $25 million a year. Julia Howard, a House member from Davie County, said in committee, said in committee when referring to whether or not the legislature should look at changing that complete exemption on property tax for nonprofit hospitals from 100% to only 50% exemption. She said, "Look, I think somebody told me I shouldn't say this, but we were all bombarded with calls from lobbyists." She quickly added to laughter, "I'm not going to pick on the hospitals. I'm not going to even mention it." Another lawmaker shot back, yes, you were told not to bring that up. And that exchange happened, according to Michelle Crouch from North Carolina Health News, during a House Select Committee on Property Tax Reduction and Reform. An alarming exchange, but it's real because it's just reporting out loud what we know. The hospital lobby is incredibly powerful and incredibly deep and well-funded bench, you know?
Yeah. Do you think there would be an appetite for something like that now given this, public fight over maybe the issue has kinda raised its head again, or no?
Yes. I think, I mean,
Hopefully, yeah.
well, it's funny, we were at a forum yesterday and somebody said, "Oh, okay, so you're gonna fix the healthcare issue," and I said, "You know what? I think the healthcare issue has gotten to the boiling point in North Carolina." Again, we're the number 1 most expensive place in the country on healthcare, and what ends up happening eventually is people realize, they can't take anymore. Small employers realize they can't afford healthcare for their employees. It's suppressing everybody's wages. It's the number one healthcare costs are the number 1 cause of bankruptcy in this state. It's hurting people too much. So, when it affects just the people, things don't tend to happen legislatively, but it's affecting the system now, the overall system. It's affecting the economy in ways that are not, healthcare can't be your economic driver,
Yeah.
because that means your businesses are getting soaked by one industry, basically. And
Yeah.
so we need a really vibrant, diverse economy. And right now, we're way too heavy in North Carolina on the sector of our economy that is healthcare.
Especially when those profits are taken out of your town, or out of your
That's right.
state. So, obviously, we're gonna keep watching that issue, but let's go to the, budget debate, and, there's been a little bit of movement this week. I don't know if there's been anything public released. Has there, Suzanne?
So the only thing I've seen like publicly released was House Majority Leader Brendan Jones did a video for social media, and in that video, he tells anyone listening that there's 8% in the House proposal for teachers, but did not indicate a number for state employees. We're just kind of in the conversation, but was not clear on what that would mean for state employees. Honestly, we are still at that point where it depends on who you ask at what time of the day, on what day,
Yeah.
where we are with the budgets. For some in leadership are feeling like things are moving a little bit and they're feeling positive about it. And 2 hours later, they'll be like, well, that went down. So, we're back at, throwing proposals back and forth between the two chambers. So there's still some things to work out. And here's the thing at the end of the day, and one of the big budget writers told us this week that the tax package is still the big thing that they're going back and forth over. And until that is done, nothing else can actually fall into place. So, yeah, whether you
Yeah.
consider that movement or not is, something's moving, but it's not moving like in a direction where we're finalizing anything, at least not this week.
So, I think that ties in with my next topic, which is the, lobby day we had on Wednesday, because most of everything that we discussed with legislators were around the budget, and, we had a pretty good crowd. I think there was probably at least 100 people showed up to, lobby for their, coworkers who couldn't come. What did you guys think?
I thought it was e I was excited to see the turnout, and I think, what we've got to remember, and legislators knew this, is we can't shut down state government to come in and have a huge showing,
Yeah.
like teachers did on the Friday before, but what our group did was got themselves down there and showed up ready to have sincere and genuine conversations with lawmakers who were actually in session that day. They were well received. We did manage to get in a lot of good conversations with key legislators. So I consider it a successful day. We were seen, we were heard, we were, received in a positive light. We didn't
Mhm.
have any cool rappers, providing music for the event.
I could have busted out a few rhymes for
I
you.
guess you could have, but it was, I was really proud of our folks. They showed up with business on their mind, and went to the legislature to handle that business. It was a good day. It's been a long time since we've had that kind of lobby day, and it's difficult. for folks to show up. So we did have a good number of our retirees show up, and they were, lobbying not only for themselves for a long overdue COLA, but, they were also showing up for active employees who couldn't be there because of the staffing crisis we have in North Carolina. And they understand that that's affecting retirees too. There are fewer state employees paying into the retirement system now than there is money going out. So that's an issue. Active employees are also an issue for retirees.
And for the General Assembly, you're gonna pay one way or the other. You're either gonna pay a higher employer contribution rate to keep the retirement system afloat, or you can just pay for services which the public already needs,
Right.
and their paychecks will put that
Right.
money in the system, and you won't have to do as big an employer contribution. I mean, it seems like a no-brainer.
Seems
Yeah,
that way.
and back to what you were saying, comparisons with the teacher rally, we got a lot of not a lot, we did have a few comments on everything we posted from the day, which we posted a lot. So there was a lot of opportunities, but, folks saying why there are only a few dozen people there, and they have to realize this is like, there's a difference between a protest and a lobby day, which is what we were doing. A lot of associations and organizations have what's called a lobby day, where they bring members
Yeah.
to the legislature and have conversations about their
Oh.
issues. Whereas, I mean,
Well,
I
I
feel
mean
like we could probably get that many people on the mall for a protest if we really,
Well, real
if
talk
that's what we
though,
were.
real talk. The teachers were supported and they were a part of an overall May Day movement. There were
Yeah,
rallies all over the country, that were huge. Chicago, I think, had such a big one, it got a lot of the press. But, God bless them. They had people come out there and support them, and the public will do that in different groups, some of which may not have been really helpful to their cause. Look, we want teachers to do well. We have members who are teachers. We want everybody, though, in the school system and everybody everywhere where else to do well. And the problem is there's too many winners and losers being plucked out. And even among teachers, the raises that we're hearing are more for rookie teachers and veteran teachers who you'd want to keep in the system. They're not going to be the ones getting those big raises. But at any rate, the teachers came down and they had tons of people who are not teachers supporting them. They had school systems all around the state willing to close down so they could come do this, and that's wonderful. I'm glad they had that kind of support, and I think people should have every right to come say their piece. The fact of the matter, though, is, people aren't gonna come out. I don't care how progressive a group thinks it is and how much for workers' rights they say they are. They actually don't show up when it's about state employee rights for whatever reason. There's that, and then there's also the fact that, to be honest, we had some people who said they had to take off Friday when the schools were closed in their area, so they couldn't take off again the next Wednesday because they had
mhm.
already had to take off a day from work. And with everybody being so short-staffed, it's not looked upon well if you take 2 days off in 1 work week to,
Yeah.
because of rallies, whether
Mhm.
they're yours or somebody else's.
But you know what? Actually, there are some brave souls out there. I actually had 3 teachers in the group that was with me at the legislature. So,
That's awesome.
yeah,
And
that
I'm
that
sure they
was
were lobbying for those veteran teachers so they don't get left out.
yeah.
We had people from Cullowhee to Wilmington. It was a
Yeah.
huge group. I was surprised that how many people outside of Raleigh came to it.
Well,
Yeah,
look, I
we
want
had some
teachers to
good
do well.
attendance.
I want everybody to do well, and NCAE used to want that a few years ago when there was a mini budget with bigger raises for state employees. NCAE said, "Why would we not treat everyone equally?" So, I'm all for that, let's treat everyone equally. But
Yeah.
we could do that. There's things we could do. It's not choose teachers or choose state employees. Don't take the bait on that BS. There's many ways to not spend money in other places. For instance, you could take any of these little carved out things for special corporate interests. Like we were just talking about the 100% property tax exemption for nonprofit hospitals that make a tremendous profit. There's so many things like that. There's so many sacred cows. All you got to
Yeah.
do is dial some of those back so that
But
you
yeah.
can actually pay the people.
And I think there is well, I know there is some appetite in with some legislators because I've had conversations about there being a more level attempt to, give raises across the board for everyone in my conversations
I
this
don't think
past
that
week.
took hold though.
No, but I'm saying the conversation
Oh,
is
yeah.
out there,
Yeah.
that I personally have had some conversations about, more level between all state employees, which, we would absolutely support that, and obviously depending on what that
Well,
amount of money looks like, so
Yeah. Well, the only other thing I had to talk about was just the, Public Service Recognition Week, which was this week, and, the summit that artist took part in yesterday. She was a part of a panel of State Auditor Dave Bolick was on the panel, Jocelyn Mittenall-Millette from DMVA,
Yeah, our
which is
Secretary of Military and Veterans Affairs.
She's
and
so
the city manager from Raleigh was on there,
Yes, she was excellent.
and there was a few other people.
Mhm.
And, yeah, I thought it was a pretty cool event. Artist spoke her mind as usual, and it was, she's not afraid to stand up for her
Well,
state employees.
there were students there from State and Carolina in the Masters in Public Administration programs, and I think it's so important to get young people into public service and to understand what it's about, but you also don't wanna give them lollipops and rainbows as the only idea of what they'll be facing, and we really I think the issue where I made the statement that was the most controversial was when I said, "Make public service cool again," and some people were like, "I didn't know it's not cool now." And what I meant by that is, look, it used to be such a state job used to be a very sought after, respected job, and it's been a very concerted effort across the country about public employees to kinda make it seem like working for the government, working in public service is lesser than, and the reason is very intentional so that you can pay them less.
I found it interesting on at our lobby day, there were some younger folks who, came to town and joined us, and I talked to several of them who love their jobs with the
Absolutely.
state, and they actually were concerned well, I mean, they talked about the, fact that they don't have healthcare coverage when they retire anymore. None of them were looking to leave their jobs, which I think is interesting
Yeah.
about younger people because a lot of times they seem to move from job to job. But that was a big issue with them, and,
Yeah.
I mean, we've already known that was a kick to recruiting folks, but that it was really telling to hear some Generation Z young people talk about not having that at retirement. So that's in their hand. They know how important that was, and they love their jobs in public service.
Anything else?
No, I mean, we had a busy week, and I think I'm considering it a successful week, but,
I'm ready
thanks
to take a day off.
thank
Right.
goodness for the
Well,
weekend.
thank you, WakeMed and Atrium, for the lack of a weekend last weekend.
For real.
'Cause we had to work
Um,
all weekend on that once it popped
yeah,
out on Friday.
that was fun though. I kinda liked it. I kinda like those issues like that.
We're a
Well,
little twisted in that way, John.
That's us next.
um, so I'll probably add in a little bit of sound from our lobby day. I think we had some interviews. Maybe we'll add to the end of this. I don't have a question of the week, but I did think of one while we were going. So let's just, I'll just ask it now. Do you think we'll have a budget in the next 2 weeks?
Yeah, no, no.
No?
I'm going with no,
I'm gonna
but
go
I'm
with
also jaded.
I'm gonna
I'm
go with
so ja
maybe. I think
yeah,
there's a
it's a smidge.
some weird yeah, there's some weird air over there right now, like, I think they're weary. Like, 1 month into it, they're weary, and I get it because 'cause we're weary too. We're right there with you,
Yeah,
Yeah.
legislators, we're weary.
but I'm still at that point where it depends on who you ask, on what day, at what time of the day, as to where they are. So I think it's just still kind of all over the board
They
at
were
the moment.
swiping at each other yesterday
Yeah.
publicly.
Oh, speaking of that, we didn't mention this. You did, artist, you did get to, you and the officers met with, Senator Berger for a few minutes,
Yes,
right?
President Powell
During
and the
lobby
other
day.
officers, Senator Berger was really gracious. He spent a lot of time with our officers, and they had some great comments. And, members and especially member leaders are always the best. They're way better lobbyists than
Mhm.
we are because they're living it. They're
Yeah.
Yeah,
living the issues. And they did a great job. And he was just very generous with his time. He intently listened. And, that's when you're getting to talk to the top guy on the Senate side, there's not a lot more you can ask for if they're gonna take time with you and really listen, so we thank Senator Berger for that time, and we thank Speaker Hall's staff,
yeah,
who Speaker Hall didn't happen to be in the building at that time. He was returning from an event he had to go to, so our officers were able to speak to one of Speaker Hall's staffers, and that was also a very good conversation, very lengthy. They were generous with their time, so thanks Speaker Hall's office as well. And thank you, Suzanne, for setting all that up.
Okay, sure.
yeah. Great. Teamwork, great
Teamwork.
job. So we'll leave it at that. Thanks for joining us this week. Listen to some of the interviews here after this segment, but otherwise, have a great week.
like this kind of microphone. It's State Employee Appreciation Day. Are you feeling appreciated?
I appreciate me.
I thought not. I figured that's why you're here. And it's Public Employee Appreciation Week for every single public employee, city, county, state, federal. Public employees, this is your week. And it's a great time to come down here and speak your mind. You know there's not a budget. You know last time there was one, you paid for your own raise. Do you know how you paid for your own raise? Because there was so much money from those vacant jobs, it went right back into the general fund. That's your money because you're doing the job of more than one person. And the tiny sliver of it you got was that raise 2 years ago that you really don't remember now, do you? And don't get me started if you are a retiree. If you're a retiree, speak up. When was your last raise? Does anybody know?
2017.
2017. There were less aches and pains in the morning last time you had a raise.
A whole lot.
So you're here on behalf of your brothers and sisters who could not be here today because they have to keep the state going. And retirees, you're here for those that cannot make that journey to Raleigh for whatever reason. Office of State Human Resources, Stacy Meyer. Would you say a few words?
Good morning, everyone. Thank you so much for this invitation to be here. I want to just thank the team at SEANC. They have been amazing. They have supported our office. I am so grateful that every step of the way, when we are at the legislature working really hard to transform state human resources, that your team at SEANC, Artis and Suzanne and Wendell, they're right there beside us. And I want you to know that this week, that is Public Service Recognition Week, the work that you do keeps North Carolina going. It impacts every citizen. It impacts every visitor. You are getting this work done. And when there are vacancies, we understand that you're doing the work of more than one person, and sometimes it's more than two people. So we do recognize that, and I want you to know that you are being heard.
Jim Royal from
Cullowhee.
probably the longest drive here, right?
No, probably second longest. There's
Okay.
some folks a little bit from the west, a little further west coming.
Western Carolina District 1, right?
Correct.
And what brought you here today?
Well, trying to bring the message to Raleigh that it's time to move forward instead of backwards. We've been going backwards for 10 years. Teachers were here a short time ago explaining how far back we've moved in education. We need to bring our message of how far we've moved back in retirement benefits, compensation in general. The reason we have a vacancy rate of 30% or more in positions of state. It used to be, I worked for 30 years for the state, and the attractive point were the benefits. They couldn't pay the same amount as the private sector could pay, but the benefits were there. Now the benefits have eroded to the point that it's not attractive anymore.
Yeah. And so how long have you been retired?
8 years, and so
You've never seen a cost
I've
of living
never
raise?
seen a cost of living raise
Okay.
during that time, and you know those bonuses just don't go very far.
We made our way over to the legislative building about 10 o'clock, and one of the first legislators that my group from the eastern part of the state ran into was House Rules Committee Chairman John Bell from the Goldsboro area, and he was gracious enough to give us a few minutes of his time, and he answered lots of questions. Let's take a listen to that.
We've moved pretty far in the last couple of weeks to get there, and so after last night, I feel pretty confident we're going to have a new spending plan.
Will retiring get something?
That's part of the plan, but now what that something is, you've got a bunch of people that have to make some decisions, but we're going to get there. I feel a whole lot better about it today as I walked in. I felt better about it Friday. I felt really good about it last night. So the parties are doing this instead of doing that.
That's good to hear.
Members from the West had a good discussion with Representative Lindsay Prather of Buncombe County. And she has a unique story in that she is a state employee herself.
Yes, yeah, I've been a state employee ever since I graduated from college. I was a North Carolina public school teacher, and I now work at a public university as well. So these issues are personal to me.
You work at UNC Asheville, is that
UNC
right?
Asheville, that's right.
Okay.
Our state employees, not only are they not getting raises, particularly the ones that don't have the step increases, but they are essentially getting a pay cut because we've seen an increase in health insurance premiums. They're having, obviously inflation, right, gas prices, all of those things are going up, but their pay is not going up. I'm worried about our state retirees as well. They have not had a real COLA in years. And again, the price of everything is going up, but there's less money that people have to pay for those things now.
A group of members from Wake County met up with Representative Erin Paré, who is one of the main budget writers on the House side, and she's from Holly Springs, and they had a good discussion with her.
So thank you for stepping out.
Yeah, I was just saying, I'm feeling good about where we are. And I was explaining that the House proposal was much more favorable than starting early on than what we saw on the other side of the water fountain. And so I think you'll be happy with what comes out as long as everything continues along.
Sure.
But you never.
You don't. From one day to the next, it literally can change.
That's right. Right now, it's really up in our offices.
We are guerrilla style today, out in the wild. We're at the state capitol building for Scenic Lobby Day. Had a great turnout today, I think. A lot of people came out. We have Wendell Powell here with us, the Scenic president, as well as Artist Watkins.
All right, I'm happy to be here.
I think it was good. Don't you think so, Wendell?
I think it was awesome to see everyone come out. We had a lot of people from our different, our various districts across the state. It was good to see that they were pumped up, enthused. They were looking forward to talking to the legislators or their representatives.
Well, and I think it was cool that they came from, like you said, from all over the state, but also from every kind of workplace you could think of, agency.
Oh, yeah. Even though it was unfortunate, a lot of our people couldn't make it because they had to work. Unfortunately, the staff shortages, a lot of staff just could not come out. We definitely cannot shut the state down. DMV can't shut down. Prisons can't shut down.
Wait, you can't just lock the prison up and leave?
You could, but it will be some consequences and repercussions.
Yes, we had some good discussions with John Bell, Representative Rules Committee Chairman. Folks from the East spent a lot of time with him. Folks from the West spent a lot of time with Representative Prather, Lindsay Prather.
They did, yeah, I saw that. And, well, the officers actually got to spend some time with Senator Berger today.
Yep.
Yeah.
It was a good conversation to talk about, some of the disparities and the issues that we're facing in the different agencies and as, state employees, and understand the vacancy rate and what's not having a raise or having a budget is doing to us.
Yeah. And the word is that they're probably finally hammering something out at this point. Looks like there definitely will be a budget. And the question is, what's in it for state employees? I think that it was not any secret around there today that you're going to see sort of the same thing we saw in the original House and Senate budget, which is much higher for teachers, but only really more for rookie teachers than for the veteran teachers, it sounded like.
Yeah, that's pretty much what it sounded like. Anything's a start. The thing is, we haven't had a good raise in some years, and our employees are looking forward to something. Cost of living has gone up.
Yeah.
Our retirees, this is crazy. You have people who retired at $20,000 as a retiree, and this is 20 or 30 years ago. So you can imagine what inflation is doing to them and the cost of living is doing to them right now.
Yeah.
So they definitely
need. I don't know how they're getting by, to be honest.
It's scary and makes you really think about, man, where am I when I retire, and what does my package actually look like? So it's a big commitment that they need to make to our retirees.
Yeah, I did some interviews, and Sammy as well, of some of our members and also some legislators. But One thing that struck me was Jim Rao from District 1. He said he had retired about 8 years ago, and he still had never had a cost of living adjustment.
That's right. That's exactly right.
But it's been also, that's correct because it's been 9 years since they had a COLA.
Yeah.
So right before he retired.
Yeah.
Last one.
Tough.
But we did see something exciting. Armored truck pulled up.